and welcome back to my channel. And if you are returning, thank you my Nistas and my Nistas for coming back to see how I'm doing. And if you're new to this channel, thank you so much for coming. I do videos based on nursing, lifestyle, fashion, a little bit here, a little bit that, a little bit this and a little bit of that. So whatever videos that I have on my channel, I hope that you find it very interesting, and I hope that you will feel free to subscribe, like, share, and come back for more. So today I have a topic. I will be talking about why nurses are leaving bedside nursing. So that is a huge topic to talk about, because a lot of nurses, when they first get started out in their career, they start as bedside nursing. And I know it's a misconception that everyone thinks that as a nurse you are supposed to be doing bedside, or that you are doing bedside work. And bedside, for anyone who does not know, means that you are working either in a nursing home or at a hospital, and you're giving care to the patient. So not all nurses do that. We do tend to start out doing bedside nursing, and as soon as we get there, some of us decide straight away, like, this is totally not for me. And that's me, for example. I worked at a nursing home for about 2 to 3 months, and I knew right off the back it wasn't for me. But I tried my best to continue to work there, but I really wasn't happy. So let's get right into the reasons why most nurses feel like they shouldn't settle or shouldn't continue working as a bedside nurse. So the main reason is that nurses feel disrespected. Sometimes they have nurses that come to work and they don't want to be there because they don't feel happy. So when nurses feel disrespected, that could be the reason as to why they don't want to come back to work. And another reason is that due to shortage of staff, or due to a high patient, having a high turnover rate among the nurses themselves who actually work at the facility, they may quit very quickly. So when all of those things, all those factors come into play, it makes it very hard for a nurse to actually go to work, or I should say want to go to work and feel safe doing the job that he or she is supposed to do. And that's why a lot of nurses are quitting bedside nursing. A lot of nurses feel disrespected. Have you heard the saying, nurses eat their young? So that's exactly where that saying has developed from. And basically, in a nutshell, it's saying that older nurses who have been in the field for a very long time are not very easygoing to the new nurses who come on task. So because of that, there's a lot of rift between the nurses, the older ones versus the younger one. That's kind of like the gist of what is going on. So when you hear the term nurses eating their young, that's exactly what that means. So basically with that, most nurses feel very they feel disrespected, just to be blunt. So a lot of them don't feel like coming to work because a lot of them don't like coming to work because they're not being involved in teamwork. And nursing is a job that you have to be a team player. You have to be able to give out delegations as a nurse, and you also have to be able to receive information from your CNAs or from your LPNs or from your HHAs or whoever may be the individual that you are supervising, you have to be able to give and take. You don't want to be a nurse that's actually going to just give out orders left and right and not take any type of consideration as to how the staff feel, and vice versa. You don't want to be a nurse just getting a lot of negative feedback or a lot of negativity from your staff. You don't want that happening. So nurses feel as if they're threatened, and it's just not a good outlet. So when there's a lack of teamwork, that's when a nurse's job is very hard, because one nurse cannot do everything by his or herself. They need a team in order to make sure that everything is going good. And the main thing we have to think about is the patient's safety and the patient's care. So that should be the main focus out of everything. But, you know, in reality, sometimes it's not. At times, they may have facilities that have a high patient ratio, which means that it could be like within a nursing home. It could be 1 nurse to 35 residents. And that is a lot, especially if you don't have your CNAs to help you out. It could be very overwhelming for a nurse, let alone a new nurse. So sometimes nurses are not being assisted with the education or assisted with the guidance that they need from older staff, or from their DON, or from their you know, their higher up, their management. They're not being assisted or guided the way that they should be guided. They're just, I don't want to say it, but basically they're just thrown to the wolves. And it's very sad, especially as a new grad. You want to be able to feel confident when you are working on the floor alone. And for you to feel already scared as a new graduate and wanting to make sure that you count your numbers and dot your I's and cross your T's, you just want to be able to just come to work and make sure none of your patients have any type of difficulty. That should be the main goal. But of course, at times, there's so many things that could happen throughout the day or throughout a shift. So when nurses don't get the proper support that they need or the adequate training, they don't really feel confident in the work that they're doing, and that confidence goes on to portray as feeling overwhelmed, having anxiety, just not feeling like they're not doing their best. And that is why most nurses get discouraged and decide to quit bedside nursing. So I really think that nurses need at least a month of support, a month of training on the floor with a nurse who's very skilled at what their work task is. So that nurse should be put on the floor with the best nurse that there is. If it's not the best nurse, then it should actually be that supervisor who's able to guide them, take them under their wings, and let them know what it means to be a terrific nurse. You want to make sure that they know all the gist of what they're getting into, because at times nurses don't know what they're getting into. So they want to be able to tell them the ropes of, you know, when you come onto the floor, this is what you do, this is what you have to do, this is what you look out for. Because the way that you learn in nursing school versus when you get into your first job is totally different. So you want to ideally continue to work the same way that you have been working in nursing school, but at times it doesn't work like that. At times you have to be able to manage your time efficiently and just kind of go with what's going and kind of work along with the flow of what is going on at the time. So politics in the facilities could be another reason why nurses want to leave bedside nursing. Nurses usually want to be able to come in, do their shift, and then leave. At times, a lot of times, sad to say, there's a lot of favoritism that goes on in the workplace. And it's not to say that it's only limited to nurses, because it's anywhere you go. There could be a lot of favoritism. There could be a lot of bad management by the management department. And as a nurse, it's really hard to want to do your job, which is mainly to protect and take care of your patient, when you may have management at the back of your head telling you, well, we can't do this and we can't do that, and the same thing that they can't do or don't want to do will affect your patient. So it's like you have so much things to think about and so much roles to play. You have to play the role of a social worker, a role of a teacher, a role of a counselor. Actually, a rule of thumb you should know as a nurse, and if you're working in a facility, which means a nursing home or a hospital, that if something happens, such as a natural disaster, or that the shift is short staff, or something to that effect, that you would most likely get stuck at the job. And a lot of nurses, you know, when you come into the field, you're okay doing it, but as you start a family, then you kind of think that that's not the best place where you should be anymore, because you can't afford to be stuck at a job doing your work when you have to go pick up your child from school, or you know, you have to do something very important with your family members. So at times in life, nurses have different changes, and when changes come around, you either adjust or you can't adjust to it. So at times, nurses may have a family now. Nurses may have gotten married. Maybe they have to take care of their loved one, you know, due to the sandwich generation. So it's a lot of things that could go on that makes it hard for a nurse to continue working bedside nursing. The schedule for bedside nursing is really structured. It's either like 7 to 3 or 3 to 11, 11 to 7 a.m. Those are like the main three schedules, and give or take an hour or two, because some places might be like 6 to 4. So like having a schedule like that, it's a little bit of inconvenient for nurses to be able to manage their family at times, because there are some nurses that are able to do it. But these could be the main reasons as to why nurses want to leave. So if there's anything that you want to talk about, let me know in the comment down below. So thank you so much. Thank you so much for tuning in, and I'll see you next time.